Think your annual checkups are keeping you safe? Think again. Every year, millions of people walk into their doctor's office trusting that routine health tests will protect them. But what if some of these very tests are doing more harm than good? From unnecessary surgeries to increased cancer risks, real science shows that certain common screenings can lead to false alarms, overtreatment, or even dangerous complications. In this video, we'll reveal the 5 health tests that could be silently harming you, including one that raises your cancer risk by 5% and another that leads to unnecessary surgeries in 1 out of 3 cases. If you or someone you love is over 50, this is information you can't afford to ignore. Routine tests are meant to catch diseases early, and many do save lives. But according to multiple UK and US medical studies, overtesting can lead to unnecessary anxiety, misdiagnoses, and invasive treatments that carry real risks. Barbara Starfield, a leading researcher at Johns Hopkins, found that medical errors and unnecessary interventions are a major cause of harm, ranking among the leading causes of death in the US. The key issue is this: many screenings detect minor abnormalities that would never cause harm. But once they're found, they set off a chain reaction of follow-up scans, biopsies, and surgeries. Let's start with one of the most common tests for men, the PSA blood test. While it's designed to detect prostate cancer early, the U.S. Preventive Services Task Force warns that routine PSA testing can lead to overdiagnosis in up to 50% of cases. Many small, slow-growing prostate tumors will never cause harm, yet once detected, they often lead to biopsies, radiation, or surgery, which can result in incontinence and erectile dysfunction. For men over 50, the test may still be appropriate in some cases, but it should always be a shared decision with your doctor, not an automatic checkbox. Next, colonoscopies. While colon cancer screening can save lives, colonoscopy is often overused, especially in people with low risk. A major U.S. study found that 1 in 3 colonoscopies in older adults were performed earlier or more often than recommended. Overuse increases the risk of perforation, bleeding, and other complications, particularly in seniors. There are safer, less invasive options like fit stool tests for many patients. Colonoscopy has its place, but repeating it too frequently can cause more harm than benefit. Full body CT scans are marketed as a health check for people who feel perfectly fine. But these scans expose you to high levels of radiation, increasing lifetime cancer risk by up to 5% in some cases. They also often detect harmless abnormalities called incidentalomas, leading to a cascade of follow-up tests and unnecessary surgeries. Both the UK's NHS and US FDA have issued warnings. Full-body scans should not be used as a routine screening tool for healthy people. In recent years, memory scans and cognitive tests have exploded in popularity, with some clinics offering expensive early dementia detection packages. But experts warn these tests can produce false positives, labeling healthy seniors as at risk and causing unnecessary fear. Many so-called brain plaques detected on scans never lead to dementia. The best prevention remains lifestyle, regular exercise, good sleep, mental stimulation, and a healthy diet, not unnecessary scanning. Finally, excessive thyroid screening, especially using ultrasounds, has led to a sharp rise in thyroid cancer diagnoses in countries like the US and South Korea, but without a drop in death rates. Most small thyroid nodules are harmless, yet once detected, they often lead to surgery, lifelong medication, and complications. Routine thyroid scans are only recommended if you have symptoms or risk factors, not as part of a general checkup. Annual checkups are important, but more tests don't always mean better health. The real secret to staying safe is informed decision-making. Before agreeing to any test, ask your doctor, what are the risks? What happens if the test finds something minor? Is this test truly necessary for me right now? By understanding the potential harms behind routine screenings, you can avoid unnecessary stress, procedures, and risks, and focus on the tests that truly save lives. Stay informed. Ask questions. Protect your health intelligently